I think for us, this isn't just about designing a new facility, although we do need a new facility, but this is much bigger than just about the facility. We want to redesign how we actually deliver service to patients, to have them at the center of everything that we do. And that's something that we're just learning how to do really well. The new hospital was officially announced in August of this past year, and in the past couple of weeks we started something called a 3P. A 3P stands for Production Preparation Process. You bring together all of the people who will use the facility to design the facility themselves. The goal of the week was to work with providers and patients from right across our hospital to design 3 separate areas within our hospital for how they want that space to look and feel in really tangible ways. We had a collection of people from all over the hospital, from maintenance to housekeeping to nursing staff to directors to physicians, as well as patients, came together to actually design 3 really big parts of the facility.
I'm really looking for all of the participants to really feel the communication and the sharing of information flows really, really easily, and that by the end of the week, there's a really good understanding of not only the value add that each of them has brought, but if there are things that we've had to give in order to get, that there's also a really good understanding of why that came to be.
So the teams were divided up beforehand, so it was a pretty intentional process, and it was really intentional to make sure that we had a good assembly of people that weren't just from one particular area.
So we had a team that was looking at diagnostic imaging, a team that was looking at the universal care unit, and a team that was looking at the operating rooms. So we really tried to have a mix of people on each team, not just the people that work in that particular area, but all the people that serve that area as well, because they really have a different perspective on the way that things should be laid out. So when we talk about the flow of supplies, for example, so important to have people from maintenance and housekeeping being able to have a hand in how that space gets laid out, because their concerns for that area are really important as well. This process actually starts before the week of the 3P. So we had the outside shell of the facility. This is kind of the outside boundaries that we were working in. And we had something called a functional plan, which is just a picture of the services that we needed to be able to provide long into the future. There was a group of people that tried to paint a picture of how our system works right now. They did something called a value stream map, which just basically paints a picture of how service is delivered to a patient, right from when they walk in the door until they're able to leave.
So I was part of the data collection team. What we did was spend a couple of weeks prior to the 3P event actually doing some of the data collection. So we would spend a day following different patients around in the hospital. What we were doing there was just really recording how much time did that patient spend on things like waiting, sitting in a waiting room, sitting waiting to check in and admitting, sitting waiting for the x-ray technician to come and get them, those types of things, versus how much time did they spend on things like actually getting their x-ray done or things that were actually part of their appointments.
The purpose of that is just to paint a picture of how it works right now. Before we can design how we want it to be, we want to really understand how it works today. So one of the very first things that we did, which I think was intended to set the tone for the week, was we read through a whole group of patient comments about what their experience was like. That ranged from really positive experiences to some that really could have been improved.
And so they had a couple of different sheets of paper with just anonymous feedback from different patients that they gave at the end of their visit or experience with our hospital.
Nicer and brighter rooms. I think the environment where you are put in is very important to your healing.
What that intended to do was to help us think about what the patients were telling us about their experience in our facility. And that gave us the direction for the week, to be able to really think about things from a patient perspective.
It just kind of helped us put into perspective again, why are we here doing this?
The way we used fishbone diagrams here was to understand all of the components that it takes to deliver a service, all of the equipment, all of the supplies, and the providers to be able to deliver that service.
The fishbone diagram is designed to capture the whole process of patient from the time they get scheduled in the operating room by the OR schedulers, the registration, then their movement and all the processes, the people, and the methodologies that we use and the materials used in order to provide them that one surgery in that day.
What I found to be really valuable about the fishbone diagrams was that it allowed you to kind of track that process, the same kind of process that we did for the value stream maps, but add a different level of detail to it. By the end of it, you start to really gain a sense of understanding better, okay, there's a lot of repeat work in a couple of these things.
What we found was very interesting is, first, everyone has a different idea of how you're going to do things. But what was really nice is we're capturing all the people involved to provide that service. So the people you don't see that's behind the scenes, the IT, the lab, biomedical, housekeeping, CSR, all of these people that are involved just to bring that one surgery to fruition. I think we kind of had an idea, but I don't think we had an idea how much is involved. It's like a symphony.
We spent some time learning about some of the ideas that we wanted to include in how our facility was designed. So we looked at how patients will move in our space. We looked at how the people that deliver service, the providers, how they'll be able to move and flow in their space. And then we looked at how supplies move in and out of that area. And you wouldn't believe how many supplies actually go into running a hospital. It's a huge consideration. Coming together with this broad group from right across the hospital to decide ahead of time, before we've committed anything to paper, what do we want to make sure is present in that facility? So they looked at things like how patients flow, how supplies would move. Was the space expandable? So if our needs increase, will we be able to expand this space really easily? How staff would move? Whether things could be kept confidential in that space. So they came up with a list of criteria that they would evaluate their ideas against once they started to draw them out. And throughout this process, they've been able to keep those ideas in mind and keep checking back as they've designed their spaces. Have we met that criteria? And that helps us really make sure that we're keeping the main things. The adjacencies exercise was a really important part of the week. And with adjacencies, all we're talking about is who lives next to each other, what departments are right beside each other, right from the whole main floor of the hospital. That's the space we were looking at and trying to decide how do we best lay this out to meet our patients' needs and how the people that work in that facility, how they move throughout the facility and how supplies move throughout the facility. What's the best way to lay this out?
I think it brought about a greater level of understanding for some of the people of how important it is for some areas to be closely located to each other and how what some of the dependencies are.
This process forces you to think outside of just your area. Such an important part of people coming to the place of owning how their facility was going to look in a broad sense. Then we moved into a phase of iterative process of designing what should it look like.
They've gone through the flow, they've looked at their existing condition and their future state, and now they're taking that and starting into the process of the real design. They're getting it into the building. So they're starting to go from the abstract into the real.
In each of the teams, everybody did 7 drawings. And then from there, the teams were tasked with taking that total number of drawings. So for our team with 12 people, we could have had upwards of 84 drawings. Pare that down from 84 down to 7. 7 we like the most. Then go through that 7 kind of with a fine-tooth comb to say, what do we like about this? What don't we like? You know, there are other elements that we would combine from one into another. And then pare that down to our top 3. And once we had our top 3, then each group went around and did a report out to the whole group, just explaining these are the 3 that we chose and this is why we chose these 3.
When what you're working with is just a drawing, that really doesn't give you a good perspective of space and how things actually move. But when you move into 3D models, both 3D models of the whole space, but then some of the big room mock-ups you see behind us here, that really takes it to a whole other level. What that allows us to see is how do our ideas translate into reality. So in the room behind us, for example, this is an emergency suite, emergency room in the universal care unit. Designing that helped us understand, okay, how does the bed actually fit into this space, and how will we actually deliver supplies into here? Where will their family sit in this space? How will we lay that out? And so the process of building life-size mock-ups helps us to really understand how that space will actually get used, really.
I think that's really where we started to see people kind of turn a corner there. Our Universal Care Unit team and our Diagnostic Imaging team really had a kind of a light bulb moment there. Because there's certain areas, like an ER room needs to be really closely situated to a CT scan suite. And so that was a key thing where they realized, okay, well, we might be planning to put these totally far away from each other. We actually need to make sure that they're almost directly beside each other. So it's just a quick, straight shot from an ER room right into a CT scan room.
One of the great things about the way the week works is there's this continual process of designing and then reporting back to the group. It's not just that this little group gets in their space and thinks about just themselves. They're always having to report back to the group, and so the bigger group always has a chance to feed back into their idea. And not only that, but after this week, the things that we've designed here will go to the staff in the hospital, and they'll have a chance to feed into that process. And all of that feedback then will go to our architects to put all those ideas into drawings to bring back to us.
I'm very pleased with everybody's participation. You know, it's a 40-plus person team, and sometimes with a group that large, you know, people tend to step back, but everybody's been engaged. Our patient partners in this effort have been fantastic. They've been very vocal about what they need from a patient perspective.
Anybody that takes us to deliver the best care is good for us, and we think that this is a good process.
Although we always put the patient first, we don't always focus on simple things like how many steps does a patient walk to get from A to B, who stocks the stock room, and how many steps does that person have, and how do we make that flow better. It makes you start thinking, well, you can't just think of one thing, you have to think of three things. And just as you think you've got something right, you see how it messes something else up. So you have to rethink the process. It has created that need for networking and the need for collaboration and discussion. And as I say, that's what's impressed me. I don't think there's one individual person here who has been a specific influence or who has directed this event. Not one person's decisions have impacted someone else's decisions. I think everyone's decisions have impacted everyone, and it's been a complete team effort. I don't think anything's ever perfect for everyone. So when we move into our new building, there are going to be the naysayers, and they're going to be people who say, we don't like this, it doesn't fit or it doesn't work. The reality is don't blame one person, because that person may have been your representative at this 3P event. What you have to remember is that it wasn't that one person that made a decision, it was everyone. There's teams of 20 or more people all collaborating, discussing, and there's 3 teams of 20 or more people all collaborating and discussing.
No, I think we accomplished a lot more than I thought we were going to. Is that right? When we were given the agenda at the beginning of the week, I didn't think that we would even get close to this, but from what we've done with the models and got this far is actually, I think, remarkable.
It was an awesome week, like really awesome. I didn't really know what to expect. I had some idea, but it really turned out to be a lot more challenging than I expected.
Oh, the week's been very good. There's been a lot of different mind shifts for a lot of people, which is good. I would say the most rewarding is that I see a lot of future potential with what we can do.
Well, it's very interesting. There are challenges that the staff face that, of course, the public doesn't realize.
There's been a fair amount of flexibility take place at the administrative level, I would say, to approach completion in the areas I'm working on. There's been some space trading, and I think they're getting to a design that the people who work in those areas are extremely appreciative of. I think there's a lot of resistance in how things could work, and that resistance seems to have fallen away a lot in this week to come to more ideal patterns for the people that work in those areas. That's nothing but good, and I think that's what this process is for.
Highlights for me would have to be that I realized that the needs of everybody are so important. That it's not just one person, not one department, it's everyone's needs.
I think my big takeaway from the week has to do with the process that we went through. The first couple of days it felt like, I don't know if this is going to work. There was lots of doubt. It was pretty tough treading, and by the end of it you kind of saw the brilliance in the process. So quickly we want to get to that finish line, and we want to know what the finish line looks like. We just want to go from where we are right to that finish line, and we don't want to have to do all of the potentially difficult steps in between the here and the there, and really that's where the great learning, the great collaboration, the trust is built, all that kind of stuff. So for us, this isn't just about building a hospital, this is also about developing and building a culture that's going to also feed into that new hospital and ultimately shape how we provide better healthcare as well. So that's the part for me, the takeaway that I really love, is that it wasn't just about designing a room, it was also about developing relationships and building a culture here that's going to propel us.
We're very much at the beginning of the design process. So we have, like I said, the outside shell of the facility. That's pretty tight. And at the end of this week, we've designed 3 bigger parts of the facility. So from here, the design work that was done this week will get translated into architectural drawings and come back to our group to say, is this what you meant when you put these mock-ups together? And then from there, we'll go into 2 other areas in our facility to go through the same process again. You're bringing together this group of people from right across your facility to actually design the facility. And they go through a variety of steps along the way. But at the end of it, it's the people using the facility, designing the facility.